Graves and thyroid disease, the journey. Chaseley MD. ENT-oculoplastics. Skull Base. Cupertino, California. Graves and thyroid disease, the journey. Surgical considerations. Graves' disease. Surgical considerations. Thyroid hormone is critical for regulating mood, weight, and mental and physical energy levels. If the body makes too much thyroid hormone, the condition is called hyperthyroidism. An underactive thyroid leads to hypothyroidism. Graves' disease is the most common cause of hyperthyroidism, caused by an abnormal immune system response that causes the thyroid gland to produce too much thyroid hormones. Body actually produces antibodies that activate thyroid hormone production. The thyroid and Graves'. Graves' eye disease, inflammation. Signs and symptoms: anxiety, breast enlargement in men, possible. Double vision. Eyeballs that stick out, exophthalmos. Eye irritation and tearing. Frequent bowel movements. Heat intolerance. Increased appetite. Menstrual irregularities in women. Muscle weakness. Nervousness. Rapid or irregular heartbeat, palpitations or arrhythmia. Restlessness and difficulty sleeping. Tremor. Weight loss, rarely, weight gain. Testing for Graves' simple blood test. TSH, T3, T4. TSH receptor antibody, thyroid stimulating immunoglobulin or TSI. Ultrasound of the neck if thyroid is enlarged or a mass felt. Surgical Graves' disease. Hyperthyroidism or progressing eye disease in patients who can't be treated with radioactive iodine therapy. Rapidly worsening thyroid eye disease. Enlarged thyroid or goiter causing difficulty breathing or swallowing. Women interested in becoming pregnant. Nodule in a patient with Graves' or family history of thyroid cancer. Suspicious thyroid nodules. Change of malignancy in thyroid nodules is double in context of Graves'. Thyroid nodules are common. Can be found in 5% of the general population. Mostly benign. Can be observed if there are no risk factors. www.mythyroid.com. Detecting thyroid nodules. Physical exam. Ultrasound. What is a suspicious thyroid nodule? A large nodule, greater than 1 cm. Any nodule over half a centimeter in size in a Graves' patient. A thyroid nodule in a patient with a family history of thyroid cancer. A history of radiation exposure. Age younger than 20. Age older than 50. Surgery and risks: general anesthesia, small incision in the lower neck. Hoarse voice. Vocal cord weakness. Visible incision. Bleeding. Low calcium, total thyroidectomy. After surgery, small incision, quick healing. Typically stay in the hospital overnight. Back to work in 2 to 6 days. Complications with nerve weakness, post-operative bleeding, or calcium regulation may delay return to work. Surgical treatment of eye disease. Marty Feldman. Graves' eye disease, inflammation. Combination of compression of the optic nerve and inflammation of the nerve. Orbital decompression and fat removal. Performed both endoscopically and externally. Surgical treatment to save or restore vision. Should be thought of as a medical necessity. Additional corrective surgeries are often required. Typically outpatient procedures. Endoscopic decompression, extended or advanced sinus surgery. External decompression. Risks of decompression surgeries. CSF leak during endoscopic surgery. Diplopia or double vision, often pre-existing. Bleeding. Infection. Eyelid retraction or drooping. Droopy eyelid repaired.